A line forms outside a van in the Woodlawn area in Chicago's South Side. This is the Chicago Recovery Alliance, a street-based harm reduction program that has been in operation since 1992. There, I meet Steve. He's still coming to terms with the death of a friend who had overdosed after taking the synthetic opioid fentanyl the day before.
My friend, she took a chance and shot the bag of dope, and she started changing. Her health started changing. Then she fell out, passed out. They tried to revive her with the fentanyl. She wouldn't come back. Then they called the ambulance. Like 6 or 7 hours, she was pronounced dead for a fentanyl overdose.
The U.S. opioid crisis has drawn bipartisan support from politicians, with greater funds and programs in place to combat the epidemic. Around 48,000 people lost their lives to opioids in the United States in 2017. Synthetic opioids like fentanyl accounted for 60% of the fatal overdoses. This van dispenses a range of different drug-taking equipment, from different-sized needles to snorting kits to crack pipes. But key to stopping opioid-related deaths are these fentanyl test strips, as well as naloxone, which is used whenever there's an overdose. Naloxone can reverse an opioid overdose. Although this van hands the kits out, they can be expensive and inaccessible elsewhere.
The key weapons going forward are, widespread universal naloxone availability. There's a great deal of research demonstrating that take-home naloxone distribution to peers, people who are actually using drugs, makes a huge difference in preventing overdose death.
Cheryl Hole has worked with the Alliance for almost 26 years.
Dead addicts don't recover.
She says the resources available to help users is simply not enough.
People want to go to treatment now. But when you tell somebody, well, you got to wait a month, you're going to lose them.
In the neighboring U.S. state of Iowa, opioid-related deaths declined by 33% last year. But Sarah Ziegenhorn, executive director of the Iowa Harm Reduction Coalition, questions whether the decline is because of any new policy shift.
Is it really true that fewer people are dying because there are interventions that are helping people improve their health? Or is it the fact that there are fewer people left available who are using drugs who can die?
Ziegenhorn is also surprised the opioid issue has not been more prominent ahead of next year's U.S. presidential election.
Even though both political parties have addressed some attention to the crisis, a significant amount more will be needed in terms of making real commitments that will lead to real change.
The U.S. opioid crisis may have been in the political spotlight for the last couple of years, but it would appear from those on the front line it's still not enough. Dan Williams, CGTN, Chicago.